So I'm Jamie White, and I'm here to talk to you all about closing the women's health innovation gap globally. Excited to be here again, grateful to have the opportunity to speak to you all today at the HIT Lab meeting that you are having focused on digital health. So just quickly, I wanted to give a quick overview of our office and kind of what we do at NIH. Similar to something that Mike said earlier, we are not just one NIH, we have 27 institutes and centers. And I'm hosted in the OD, or the Office of the Director. And my office has the specific mission of enhancing and expanding women's health research, also the inclusion of women and minorities in clinical trials and clinical research, along with their promotion of career advancement for women in biomedical careers. And that's hopefully to get to the space of where we can actualize the NIH vision for sex and gender integration into biomedical research, along with that every woman can receive evidence-based personalized care, and that women can reach their full potential when it comes to their science careers. Just briefly wanted to quickly also highlight kind of how we define women's health. It's not necessarily the most common way. So the old paradigm oftentimes was thinking about reproductive issues and also the breast. Some people call it bikini medicine, along with thinking and focusing on maternal health and or infant health, along with there's sometimes a focus on women, how they are specifically different from women, specifically different from men, sorry about that. And that's somewhat an old paradigm. The way that we have a tendency to look about this is thinking about the health across the lifespan, thinking about from head to toe and mind, body, and spirit. Also, we have a focus on overall health and wellness. And then we're thinking around how sex and gender has influences on all aspects of disease and treatment. And to that regard, I think it's important when we talk about research on diseases and conditions when it's pertaining to women's health, we're thinking about only on women, mostly on women, and also differently in women. So just quickly, I wanted to give an overview of the extended ORWH multidimensional framework that we leverage and use that thinks about intersectionality and also intersectional factors that affect the health of women across the lifespan. And we're thinking about that from pre-pregnancy all the way to that of an adulthood, and also past menopause into your golden years. But when we think about this, we think about it obviously from a biological perspective and internal factors such as sex, age, or genetic ancestry that has influences on genetics, obviously molecular, cellular, and physiological levels. But in addition to that, I think it's extremely important to think about women in the context and also within society. And so those external factors such as gender, generation, race, ethnicity have influences on an individual, also in a different level as far as interpersonal, community, and societal levels. So getting to the women's health innovation gap and the systematic sources of this and how we got to where we are, as oftentimes the inattention to effects on sex and gender on health, along with the underinvestment in health conditions relevant or limited to women, workforce diversity and inequities, along with societal attitudes, unfortunately. And I'm going to go through quickly a few of these examples. And I would think it's important, obviously, that these were probably highlighted earlier before, but just wanted to quickly understand the sources of these so we can talk about some of the solutions and how we can actually close this gap. So the inattention to effects on sex, gender, and intersectionality on health, how do we get here? Oftentimes, you've probably been hearing there's been an over-reliance on male animals and cells. Oftentimes, cisgender, white, 70-pound kilogram men, along with study designs, do not always account for sex and gender in their studies. There's an inconsistent reporting of such specific findings in publications, and or they're not disaggregated data. And then also there's oftentimes a lack of perspectives, specifically of the patient and also their lived experiences in R&D. And what this leads to is some of the consequences of this is an incomplete knowledge base, also a risk of erroneous conclusions, sometimes an overgeneralization of the results related to different populations. This could also lead to risk and harm and toxicity surprises, along with the failure to actually maximize the return of investment. Obviously, NIH being one of the largest funders really cares about this. And then also it could be an erosion of public trust just because of the generalization is not correct. In addition to that, there's obviously an investment in health conditions when it's relevant or limited to women across the biomedical enterprise. I won't go over this slide because I'm sure you heard about it earlier of how oftentimes it's only, you probably hear approximately 1% of healthcare research and innovation is invested in female specific conditions beyond oncology, and the oncology part is only 4%. So a whopping 5% goes to this. And so I think it's important for us to just understand that. But on the left side, that's what's showcased on the left side. But on the right side, I just wanted to quickly also highlight that studies specifically from NIH that's been shown to have a gender disparity in the allocation of NIH research fundings among diseases that are more either male dominant and or not female specific. So just wanted to highlight that. In addition to the fact that, again, there's an underinvestment, oftentimes work diversity and equities. Oftentimes women are significantly less likely to be named on a given article or patent. We do know that things that are patented oftentimes have some relevance into what innovation actually comes from. And in addition to that, being relevant to their team versus that of their male peers, they're less likely to be retained and or advance in STEM. So just wanted to quickly highlight this. So I think it's extremely important to think about the workforce issues that might have this, because we do recognize and realize that oftentimes women who do patent oftentimes have a focus on women's health. And so if they're not a part of the conversation as far as creating these solutions, then oftentimes we will never see the solutions come to bear. So back to, I said the doom and gloom, and I apologize about that, but I definitely want to talk about some of the sources of these issues so we can get to some potential solutions. And some of the solutions that we've seen that could potentially work or help is thinking about systems approaches to what's called SABV, which is sex as a biological variable, along with diversity in clinical trials. Obviously, again, if there's more investment in women's health and funding for diverse individuals in the biomedical enterprise. In addition to that, obviously eliminating barriers for women and other marginalized individuals by leveraging FinTech. Obviously, we want to make sure that we are doing that in a way that is equitable, but also just recognizing, particularly for this conference, the data is only as good, the AI can only be as good as the data that it's leveraged on and used. So just wanted to highlight that. And I think it's also extremely important to think about how do we listen to women and understand their added value. Also, again, them being vital customers when it comes to healthcare. And then lastly, I think there should be a focus more on health literacy and equity, which was also previously discussed before. But on the equity aspect of things, I just want to highlight another way in which we've come together with a lot of different stakeholders to think through and think around how we can have potential solutions. So I'm just going to quickly highlight a program that we recently launched and had, and this was in partnership with the Gates Foundation, and it was called the Innovation Equity Forum. And one of the deliverables for that was the Women's Health Innovation Opportunity Map. So just as a quick overview, the Innovation Equity Forum basically, again, was a partnership that my office, along with the Gates Foundation, put together to advance global collaboration for women's health R&D. And we hosted a two-day convening on July 6th and 7th of this year. And that was hosted on the NIH campus. And the goal of that was to convene a global community of key stakeholders and gatekeepers of health innovation around women's health R&D, along with mobilize and accelerate innovations to improve women's health through shared understanding of select critical women's health R&D priorities. And then lastly, but of course, certainly not least, is fostering cross-sector multinational partnerships to advance R&D efforts in women's health innovation. And again, that was done, or we're hoping to do that through enhanced coordination along with collaboration. So just so people understand, the mammoth project that was done over the course of 9 months, we had a partnership with over 250 members, and it's still growing. We are still looking for additional members if you have interest. So please feel free to reach out to me if you do have interest after you hear more about this. But the aim for the forum itself is to be comprised of a broad range of multidimensional or multidisciplinary experts from various levels and sectors of the biomedical enterprise, again, to provide diverse viewpoints. We extremely think it's important to have different viewpoints. Everyone's not going to think about these things in the same way. But we also want to be very inclusive and globally focused, and also have a widely accepted opportunity map, which again, I will discuss shortly. So just quickly highlighting, we have people from multiple sectors, as you can see here. Again, we have a range of age distribution along with gender. We do obviously have more women that were a part of this, but we were grateful for the men that took part in this with us. And this is also represented from over 50 countries. So what was in scope for the Women's Health Innovation Opportunity Map? Again, the health issue for this was thinking around the unmet health needs of women and women's health, and thinking about that, again, similar to what I was explaining before of how we define women's health as female-specific conditions that that affect women disproportionately, in or differently. And then also we wanted to make sure we highlighted conditions that were understudied, or under-resourced, or underserved in women. Lastly, when we're thinking about the affected population, when we coined and talked about women, we were inclusive of female assigned at birth, transgender, and non-binary individuals, along with thinking across their lifespans worldwide, across different demographics, including race, ethnicity, age, and generation, along with socioeconomic status and or caste. And then we also I want to quickly just highlight, we're thinking of the time frame for this impact. This is not a 2050 type of initiative. We really wanted to see something happen within the next 5 to 15 years. And so just wanted to quickly highlight that there. And when we have the stakeholders who can use this and value this, hopefully, we were thinking of funders, researchers, clinicians, patients, program implementers, policymakers, product and service providers, along with obviously women. And then lastly, I think it's also extremely important to highlight what we were expecting for our returns of investment for this, and what we hope to see happen is thinking about the acceleration of innovation for women's health, ultimately, again, to reduce morbidity and mortality, but also well-being, increase well-being for women. So this is just a quick overview of the roadmap, and I'll go into detail around this in a second, but just wanted to quickly highlight that we did start this initiative in January 26, 2023. And then that we actually launched the opportunity map in October 2023. Was excited to do that in Dakar at the Grand Challenges meeting that's co-hosted with the Gates Foundation. And right now we're in the stage of dissemination. And so that's why I'm here to talk about this. So just quickly, a part of this group was 11 subcommittees. Again, with 250 people, we wanted to make sure that we could divide people up with their expertise. And so we had cross-cutting topics along with issue-specific topics. And then lastly, we did have a group focused on partnerships for women's health R&D. And each of them had a lens that they were thinking through this and thinking around this, and that's to serve the underserved, sex and gender influences, a life course perspective, and then obviously quality of life and well-being. And I just will quickly highlight, it was important for us to really think through and make sure that we have representation from both high-income countries and low-income countries, because they might have different perspectives on this particular issue. So I wanted to just highlight that it's extremely important for us, for our leadership and the team that we have, that there was representation from both a high-income country and a low-income country for these particular topics. I will just quickly highlight that we started with 320 opportunity ideas for ways in which we can move forward, but we dwindled that down through a process from February all the way to that of June. And when we convened at our meeting in July, that is when we focused specifically on making sure we had the topics that we wanted to generate. We landed on at least 5. We landed on 5 for each of the topics, and then the one topic had 10, which specifically was the female-specific group. We, in addition to that, really discussed at the meeting the solutions. We really wanted to get to solutions. So we have opportunities, and that's great, and that's wonderful to talk about. But it was really critical for us to understand the solutions for those particular problems or opportunities that we saw. So just quickly highlighting again, we came up with 50 equitable high return opportunities to advance global innovation for women's health. And we had a focus of thinking around new markets and opportunities, reducing morbidity and mortality, along with strong economies and leadership. And then we also obviously wanted to improve societal outcomes. And I will go to the next slide just so you have an opportunity. If you want to see the opportunity map, the barcode at the top should give you access to that. But the table of contents for the opportunity map, it is 120 pages. I think it's a good read. I think you should enjoy it. But just highlighting that we have an executive summary that's also showcasing the case for women's health R&D, along with the methodology of how we got to this opportunity map. But within each of the topic sections, we discuss and talk again around the opportunities themselves, along with the solution strategy. So I would argue that's the most important to me. And I would venture to say that I think that would be very important to this group, because there is some highlights on digital health and ways in which we can leverage digital health to help with this space, along with, again, cross-sector partnerships for women's health, centered on R&D. And I just will highlight quickly on this slide as well, while you're hopefully pulling out your phones and looking at the barcode. We do have a shortened version of this, and it's a 4-pager that just highlights the opportunities, and it's an executive summary for those who may or may not have 120-page time. You do have a short version of that, so just wanted to highlight that. And all of these are highlighted on our website. So because I am the Health Science Strategy Relations Lead in the office, and my major job is thinking around the ecosystem and also how we play with others when it comes to thinking around these issues, I just wanted to quickly highlight this slide that talks about, again, thinking around the landscape, along with the stakeholders with diverse motivations and skill sets, but they also represent different geographic regions, along with possessing different forms of power and influence. And I think it's important to think about that from an equity aspect. And then obviously we engage with them collectively as partners, and they will be key to building a robust and equitable R&D ecosystem, including that of the digital health space for women's health. And I just highlighted quickly here some of the particular groups that we think is extremely important and the role that we see as far as how they can advance and help with advancing women's health, and as far specifically women's health R&D. And I hopefully didn't go over my 15 minutes, but I just wanted to quickly highlight, again, the cross-sector partnership for women's health innovation. I think it's important because I really think it's important for us to really come together and bridge gaps and bridge silos that oftentimes are in this space. And so the current state is oftentimes nascent. It's kind of early days for us, which is crazy, being that we've been on this earth for as long as everyone else, but it's still somewhat in its early days when it comes to getting the funds that it needs. But it's also siloed. And so we want to move to a space where the future state, where it's more robust, it's well funded, and it's more of an equitable ecosystem. And that attributes of that particular space is more researchers, investors, funders. Obviously, we want to have plentiful public and private funding. Gender equity is integral to being and thinking around health R&D, along with that women and girls are centered as equal partners, representative of geographies and demographics. And then lastly, but of course not least, we want to have balanced and equitable distribution of power and resources, and obviously more innovation to be introduced and scaled. And so I argue that I would love for those who are in the audience to please join us in this effort. And if you want to connect with us or connect with ORWH, please leverage these particular things, but my email is here. And if you have questions, ask Mike. He'll hopefully be able to answer them for you since I'm not there present. But thank you again for the opportunity. And if you need anything from me, let me know.